Smoking and lung cancer. My name is Sophie Williams, and I am a sophomore at the University of Arizona. I am currently studying psychology and nursing with my end goal to become a registered nurse practitioner. I will be focusing on the correlation between smoking cigarettes and lung cancer. My information is credible because all of the information is coming directly from medical professionals and credible sources. Lung cancer is a horrible disease that is directly related to people who smoke cigarettes. Lung cancer affects the lungs and lymph nodes, and the prognosis and survival rate is not very high, but depends on when the disease is diagnosed. There is no clear cure for lung cancer, but several things are done to try and get rid of the disease. To start off, lung cancer is a type of cancer that begins in the cells of the lungs, which are the organs responsible for breathing. The lungs, which are found in the chest, are in charge of absorbing oxygen into the body and expelling carbon dioxide. Lung cancer can appear anywhere in the lung, but it typically begins in the cells that line the airways. Non-small cell lung cancer and small cell lung cancer are the two primary subtypes of lung cancer, which can be separated by the cell types from which they develop and the ways in which they grow. According to the American Cancer Society, approximately 85% of instances of lung cancer are non-small cell lung cancer, also known as NSCLC, making it the most prevalent kind. The term NSCLC refers to a number of distinct forms of lung cancer that have a lot in common with one another and can be treated similarly. Adenocarcinoma, squamous cell carcinoma, and giant cell carcinoma are the three primary types of non-small cell lung cancer. The American Cancer Society also states that about 10 to 15% of all instances of lung cancer are small cell lung cancer, also known as SCLC, which is also known as oat cell carcinoma. Small cell lung cancer is a less frequent but more dangerous kind of lung cancer. Small cell lung cancer is named for the small oval-shaped cancer cells that are characteristic of the disease when seen under a microscope. In contrast to non-small cell lung cancer, small cell lung cancer is often not operated on because it has spread by the time it's discovered. The main course of treatment for small cell lung cancer is chemotherapy, which is frequently combined with radiation therapy to help decrease the tumor and stop it from growing. Another more recent method for treating small cell lung cancer is immunotherapy, which is currently the subject of many clinical trials. It's crucial to remember that although small cell lung cancer is more aggressive than non-small cell lung cancer, it also responds to treatment better. The key to bettering results is early discovery and treatment, though as small cell lung cancer frequently spreads very swiftly. The smoking is linked to lung cancer. The Mayo Clinic states that smoking is directly related and is the leading cause for lung cancer. Smoking causes lung cancer by damaging the cells that line the lungs, and a cigarette smoke is full of carcinogens, and changes in the lung tissue can begin almost immediately. The American Cancer Society points out that smoking has a substantial link to small cell lung cancer, which is uncommon in non-smokers. It is an aggressive malignancy that spreads quickly to the brain, liver, and bones, among other organs. Due to this, small cell lung cancer is frequently discovered when it's already advanced, and chemotherapy and radiation therapy are the usual forms of treatment. Smoking not only raises your risk of developing lung cancer, but also of throat, bladder, and pancreatic cancers, among other cancers. Smoking is also a significant contributor to the development of other respiratory conditions like emphysema and chronic obstructive pulmonary disease. Since many years ago, there has been awareness of the connection between lung cancer and cigarette smoking. Studies linking smoking to lung cancer started to appear in the 1940s and 1950s. By the 1960s, there was enough solid scientific data to warrant public health warnings about the dangers of smoking. Lung cancer is a devastating disease that has significant negative impact on the population of smokers. Lung cancer has one of the highest mortality rates of all types of cancer and is the leading cause of cancer death among both men and women. This means that many smokers who develop lung cancer do not survive the disease. Even if smokers with lung cancer survive the disease, they often experience a reduced quality of life. Lung cancer can also have significant emotional impact on smokers and their loved ones. The disease can cause fear, anxiety, and depression, and it can be difficult to cope with the physical and emotional effects of the disease. Overall, lung cancer has had a significant negative impact on the population of smokers, affecting not only their health and well-being, but also their families, communities, and society as a whole. Quitting or even reducing smoking can significantly improve the smoker population's quality of life at the individual level. At the community level, smoking affects everyone that you are around, and secondhand smoke can have the same effects when it comes to lung cancer. Switching to a more natural form of nicotine or patches can reduce the cigarette brand overall, which would help more smokers quit. At a systemic level, people need to become educated on the harmful side effects of cigarettes on the human body. Teenagers are a target audience for the tobacco industry because they are not well educated on the topic. The type and stage of cancer, the patient's general health, and their age are some of the variables that affect the prognosis of lung cancer. The prognosis is generally better the earlier the cancer is found and treated. Lung cancer has a 5-year survival rate of roughly 19%. However, this may vary from case to case. The 5-year survival rate is substantially greater at about 56% if the cancer is contained and has not migrated to other body regions. The 5-year survival rate falls to about 5%, though, if the cancer has spread to other organs. With a 5-year overall survival rate of roughly 19%, lung cancer has a generally low survival rate. However, depending on the stage of the cancer at the time of the diagnosis, the survival rate varies considerably. The signs and symptoms of lung cancer can vary depending on the stage and location of the cancer. Some common signs and symptoms of lung cancer include a cough that does not go away or gets worse over time, difficulty breathing or shortness of breath, especially during physical activity, persistent chest pain that worsens with deep breathing, coughing, or laughing, a whistling or wheezing sound when breathing, a persistent hoarse voice or changes in the voice, unexplained weight loss, especially if it is significant and occurs rapidly, unexplained fatigue or weakness that does not improve with rest, and a decreased appetite or unexplained weight loss. In conclusion, several research conducted over a long period of time have conclusively shown a link between lung cancer risk and cigarette smoking. Smoking continues to be a major factor in the development of other cancers, as well as the number of other health issues, including lung cancer, tobacco usage. Tobacco usage is still a serious public health concern, despite campaigns to lower smoking rates and health warnings. In order to safeguard their health and lower their risk of contracting lung cancer and other smoking-related diseases, smokers must be informed of the risks and seek assistance to stop.